ability of her. The reason is 4.5 out of 5 donors in India are her. It's either the wife or the mother or the daughter. Only half is the rest of us wearing pants. So how do we get her to be convinced that even if she donates, she can resume her life without pain, can wear the clothes and the kind of lifestyle she was leading prior? This would then translate into more men being convinced that if the lady can do, why not we? Because the fear of pain and scar is what has made donation difficult in this country. And again, we should I want to point out that deceased donor or cadaver donation is uncommon in our country as of now. In the Western countries, for every living donation of kidney, there is 1 cadaver donation or 1.2 cadaver donation. Whereas in our country, for every cadaver donor, there are 10 living donors that donate. So we will have to increase the pool of donation by convincing them it is a safe, painless, and effective procedure. For doing that, we needed 2 robots. We had only 1 robot. Most recipients, when they had a daughter or a wife or a mother donate, would say, let her not have pain, please use the robot on her. And that was not possible because the robot, as Dr. Basavaraj will tell you later today in the next 10 minutes, has made outcomes for difficult transplants not done in other major hospitals of the same caliber and capacity as Fortis. The robot has allowed us to do those patients' recipient surgery. So we had this dilemma, Vandwa, of what to do. And then we came up with this idea that we can get 2 robots into 1 facility, side-by-side rooms, and use this robot in real time, simultaneously for both the donor and the recipient. This idea is a 3-year-old idea, came right after COVID, but that is the reason I wanted Dr. Ritu, who won the Financial Express Award for the business leader in healthcare sector yesterday. That's the reason she couldn't come yesterday. She has come today. We forced her to come across so that the emphasis is on investment into hospital infrastructure in Karnataka on a scale that is unprecedented, whether nationally or on the Asian context. Now, to come specifically to the point of the road to have 2 robots under 1 roof in the whole of South India, we are only the 3rd hospital in the country and the 10th hospital in Asia to have 2 robots under 1 roof on 1 floor, side by side in 2 OTs. This comes at enormous cost. Bangalore is an expensive city. It's a wonderful climate. We're a very hospitable people, but it is an expensive city. So what happens is transplants should happen in a legal framework. So we have a committee designated by the government. The organization is called Jeevana Sarthakate, and there are committees. The committee needs a approval that it is a genuine citizen of that country from the embassy. Most embassies are in Delhi. So it takes about 3 weeks to get clearance from the embassies and the committee. So the stay for a patient who comes from abroad is 6 weeks more than a patient who comes from anywhere within driving distance or flying distance of Bangalore. So that adds a cost. But besides that cost, the primary cost of the human skill admission, everything remains the same. See, it has 3 costs, transplant. One is the surgical skill and the hospitalization. Second is the immunosuppression, the drugs which we use to prevent rejection. That varies from patient to patient. And last is the cost of the patient prior to surgery and subsequent to surgery. Generally, we hold on to the recipient for at least 6 weeks. We would prefer to hold on for 3 months. In Sanaji's case, she can go home and come back from her hometown in North Karnataka. But in Joseph's case, he has to stay with us. So that cost is equal to the cost of the procedure. But in terms of the specific cost, we don't differentiate whether it's a corporate patient, domestic patient, domiciliary patient, Karnataka patient, or a patient is an international patient.
My name is Joachim Joseph Omoshi from Tanzania, Kilimanjaro. What I can say that I thank you very much, doctors and all of Fortis Hospital, that the way they did transplant for me, it was marvelous. I've never felt any pain since I've come from operation. I was waiting that I will get pain in my stomach and whatever, but up to now, I have never felt any pain. And the wound, it is very little, the way I expect. So what I can say, thank you, Dr. Mohan. Thank you very much for what you did to me. And my donor, it is marvelous. May God bless you. Fortis Hospital is the best. When I go back to Tanzania, I'll tell people that Fortis Hospital is marvelous. Thank you.
मेरा नाम सना है, मेरा ट्रांसप्लांट हुआ है फोर्टिस हॉस्पिटल में. थैंक यू सर, ऑल टीम.